Hello, everyone. My name is Dr. Timothy Brown, Treasurer for the National Optometric Foundation, and I am excited to bring to you another awesome webinar on behalf of the National Optometric Foundation, Protecting the Vision. We have a great speaker that's going to be on for tonight, so I hope you go ahead and share with your family and friends so that they can tune in as well and learn all about dry eyes. Yes, she'll be talking with us all about dry eyes. But before I introduce our guest speaker for today, I want to tell you a little bit about the National Optometric Foundation and the National Optometric Association. So the National Optometric Foundation is the financial arm that supports the National Optometric Association in various ways. We try to support them at our annual convention that we have. We just recently had an awesome convention in Fort Lauderdale. The National Optometric Association, the foundation, and the Student Association were all together under one roof. And we started the convention off by doing free eye exams for the community there in Fort Lauderdale. A lot of people were able to get free eye exams and free glasses at the time, get their health check as well. And it was amazing. The turnout was incredible. So those are one of the things that we try to do, and we want to thank BSP for coming alongside with us and providing the glasses there and making the glasses for those patients who were there with us in Fort Lauderdale. And as also as part of the support that we give to the National Optometric Association, we try to support students who are currently in optometry school, or they're in high school thinking about going to optometry school, or maybe they're not sure what they want to do or what they want to choose as a career pathway. We try to come alongside those students and try to support them with scholarships. We try to help them get engaged and give them information and education about optometry and how it would be a great profession for them as well. And we want to thank those of you who have been mentors to students who are thinking about going to optometry school and those who are currently in optometry school. Thank you so much. Also, we try to support and educate the community, making sure that you are educated about your eyes, you're educated about the health of your eyes and your body. Doing these webinars is one of the things that we try to do to educate the community about their eye health. So we want you to continue to listen in. We do the webinars every third Monday in each month, and we try to have a different guest speaker on to bring information to our listening audience so that you are more educated about your eyesight and the eye conditions that could affect you or someone in your family. So we want to encourage you to share this with your church, share it with those at school, share it with those on the job with you, your family and friends, and go ahead and listen in so that you can help protect your vision, preserve your vision, and make sure that we are educating the community together. So let's go ahead and get into the webinar tonight by introducing our special guest, Dr. Shaka Norwood Bell. She is going to talk with us all about dry eyes. She's a native of Mississippi, and she received her Doctor of Optometry degree from the University of Houston. She is currently licensed in Tennessee and Mississippi as a licensed optometrist. She is board certified in Mississippi to perform YAG laser capsulotomies, and she is the owner and optometrist at Norwood Family Eye Care LLC since 2012. She's worked in corporate settings, school-based settings, and correctional facility settings, and she opened her private practice in March of 2021 in Bartlett, Tennessee, where she focuses on primary eye care as well as dry eye, diabetic, and glaucoma management. So Dr. Norwood is also a member of the American Optometric Association, as well as the National Optometric Association, where she served on the board as Region 3 trustee for 6 years and received the NOA Community Service Award in 2022. She is also a member of the Mississippi Optometric Association, and she serves as a board member for the Mississippi Vision Foundation. She also serves as a legislative key person for Mississippi Optometric Association, and she received the OD Community Service Award at the Fall 2020 MOA conference as well there in Mississippi. She's active as a member of the Jackson State University Memphis Alumni Chapter, and has been featured in the Jackson State University's alumni publication in April of 2020. Dr. Norwood is an active member of Delta Sigma Theta Sorority Incorporated and the Black Eye Care Perspective. Dr. Norwood remains as an active part of her community in Memphis and the surrounding area by participating in health fairs, school supply drives, and speaking to students at local schools about the profession of optometry. She has a passion to serve and help others where she can, and she became an optometrist to help children like herself who could not see well and could not afford glasses or contacts. And she's excited that she's serving the exact community she grew up in Mississippi Delta, and it brings her great joy and pride to know she is helping a student that was once her. She's an encourager of students to be the best that they can be in any career pathway, but she strongly suggests optometry as a top choice. Thank you, Dr. Norwood. When not caring for patients, Dr. Norwood enjoys spending time with close family and friends, exercising, movie nights, and also traveling. So let's welcome Dr. Norwood. Give us some likes, give us some thumbs up in the comment section. Welcome to the show, Dr. Norwood. I am excited to have you on as our guest speaker here in the month of July for dry eye awareness.
Oh, thank you, Dr. Brown. I'm so excited to be here, and thank you for the NOF for having me and talking about dry eye during Dry Eye Awareness Month. July is Dry Eye Awareness Month, so I'll do my part in trying to educate the community about dry eye.
Absolutely. You have been doing a fantastic job in various ways all across the globe. And I know that there are some appreciative people whose lives you have impacted, and you may not realize how much you've impacted the lives of some of the students that you've been engaged with there as you serve as the regional trustee as well there. That's why sometimes we need that person alongside of us as we're trying to decide or we're moving along in our career pathway to just be there to encourage us and tell us that we can do it, and then for them to just to see someone that looks like them as well is encouraging as well. So thank you for your role that you've been playing in the community as well.
Absolutely. Thank you.
Yes, so we are going to get into talking about all about dry eyes because sometimes people they have symptoms of dry eyes. They're irritated. Their eyes are irritated, and they may not know that they have dry eyes. That's why we always recommend those of you who are listening to us today, get your eyes checked. Go see your optometrist. Don't be a stranger. We're friendly people,
Right.
and we love to see our patients walk into the door. We love to be that person that's going to be there to give you a smile and help you find some laughter somewhere while you're visiting our office. So be sure to go see your optometrist so that your optometrist can help give you direction when it comes to finding out, do you have dry eyes? And some of you may be listening today and you're wondering, what is dry eye? So that's what we're going to dive into first. As Dr. Norwood, I'll turn it over to her to help us understand what it is.
Okay, so I just want to explain a little bit about what dry eye is. Just generically, dry eye is when a person's eyes don't make enough quality tears to lubricate and provide nourishment for their eyes. So, another definition that could be uh, associated with dry eye is ocular surface disease. A lot of people don't think of dry eye as a disease, but there are many other factors that contribute to your eyes being dry other than dryness. In a 2007 Dew study presented a formal definition of dry eye, which included all of that. So we would say dry eye is a multifactorial disease of the tears and the ocular surface that results in symptoms of discomfort, visual disturbance, tear film instability with potential damage to the ocular surface. It can be accompanied by increased osmolarity of the tear film and inflammation of the ocular surface. So, just a little bit about dry eye. Dry eye is big business. Dry eye affects 16 to 50 million Americans in the United States. That's 5 to 10 15% of the population. It costs the United States about $55 billion in the economy for dry eye. And from 2010 to 2020, people Googled dry eye, it doubled, people almost doubled Googling dry eye syndrome, trying to figure out what it is. So about 29 million Americans suffer from dry eye, and most of these Americans are over the age of 50. And global dry eye treatments cost about $6.6 billion. So that's billion with a B. So dry eye, like I said, is big money. So you would say, like, what are some symptoms of dry eye? Um, so if you have any kind of irritation in your eyes feel gritty, scratchy, they're burning, feel like something is in your eye, your vision is blurry, you having redness, stinging, light sensitivity, mucus strands in your eye. And the last one, when patients tell me, "Oh, doc, my eyes are just watering," and they don't believe me when I say, well, your eyes are dry because they're watering. They're producing the wrong amount of water. So we'll get into that a little bit later in the presentation. So these are all symptoms that can prompt you to go to your eye doctor and say, I think I may have some dry eye. So some of the causes of dry eye, the big one is age. The older we get, the less our eyes produce tears. So if you're over 50 years old, you probably have some dry eye. And the new trend is children and dry eye, because we see a lot of children and a lot of us adults, we're on our phones, we're on our computers all the time. So all of that is contributing to dry eye. And also, women are disproportionately affected by dry eye because of our hormones, pregnancy, birth control pills, or other menopause. So those are the two top contributors of dry eye. So other contributors of dry eye can be medications like antihistamines, decongestants, blood pressure medication, antidepressants, and even people on glaucoma medicines have dry eye, or those medicines contribute to dry eye. This is why we ask for a list of your medications when you come to the eye doctor, because all of those things have effect on your eyes. If you have rheumatoid arthritis, diabetes, thyroid disease, other autoimmune diseases, all of those things can contribute to dry eye. If you're around smoke, wind, dry climates, you use a computer a lot, you wear contact lenses, or if you had any kind of surgeries like LASIK, those are also things that contribute to dry eye. So I think everybody has a little bit of stress and a little bit of anxiety in our life, and that can contribute to dry eye as well. About 70% of Americans feel stress and anxiety on a daily basis. A lot of Americans are depressed, and 29% of people who have dry eye, it leads to depression because it interrupts their daily life. They can't read, they can't do their watch TV, they can't drive, because of their eyes feeling dry and the symptoms that come along with that. Our food, our diet, all the sugar we intake, all of the fats, the alcohol, those processes lead to inflammation, and that inflammation can cause our eyes to dry out as well. If you're dehydrated, you're not drinking 8 to 10 glasses of water a day, then your eyes can become dry, or at least you should be drinking half of your body weight in water per day. If you weigh 200 pounds, you should drink 100 ounces of water to prevent dry eye. You got to get enough sleep. You got to get exercise, reduce your screen time. And you also need to blink while you're doing those things, like working on the computer, because not blinking can cause your eyes to dry out as well. If you're a contact lens wearer, it's also important that you throw your contacts away on schedule. And also, I recommend a lot of my dry eye patients to wear daily contact lenses, so that at night you throw that pair away and get your new pair. the next day. Or if you don't wear your contacts on the weekend, you can give your eyes a break and put on your glasses. So a lot of things like genetics, inflammatory disease, the effects of medications, hormones, lack of oil in the tears, inflammation, bacteria, allergy, all of those are pathological links to dry eye. So some of the risk factors for dry eye is if you don't have adequate amount of tears in your eyes and you have poor tear quality. Your tears are made up of 3 layers: the oil and the water and the mucus. So all of those layers contribute to your eye being in homeostasis, which means your eyes feel comfortable. So the oil layer prevents the evaporation of the water. The mucus layer spreads the tears out evenly over your eye. And if your tears evaporate too quickly or don't spread over your cornea, there that can lead to defects in your eye, and so dry eye symptoms develop. So complications of dry eye: you can get eye infections, you can get damage to the surface of your eye, and it can, like I said earlier, decrease the quality of your life, which kind of leads to being in a depressed state. So I'll just talk about the different mechanisms that go along with dry eye. So the first one is the meibomian glands. Meibomian glands are glands in your upper and lower eyelids. They're on the picture there. Those are pictures of healthy glands, the little white lines that's going through there. So when those glands start to dry out and they die off, then that's when you start having major symptoms of dry eye. So the meibomian glands secrete the oil into the tear film. The meibomian glands are essential for your eye health and comfort. When you lack oil, your tears evaporate from your eyes too quickly. And then your corneal nerves start to be exposed, and that's when you start to get the pain and burning sensation and the visual discomfort. And then that's when you find yourself blinking a whole lot to clear your tears, to clear your eyes, to help you see better. The next form of dry eye is called aqueous deficiency. That means there's not enough water in your eyes. The lacrimal gland is located under your brow bone on the temporal side, and we can't see that when we examine your eyes under the slit lamp, but we can assess the function, which the lacrimal lake, which means there's a normal height of tears that's supposed to be on your eye. And if that gland dies or, goes away, then it can be linked to dehydration and Sjogren's syndrome. Chronic inflammation. It's a vicious cycle. Inflammation is. It's the root of dry eye, and it's very difficult to get under control. When inflammatory cells start to happen, they recruit other inflammatory cells. So your body is constantly being inflamed. Inflammation presents as redness and tear film debris, and it can cause your eyelids to be red and large, lumpy. They have a little vascularization on your eyelids, and also a lot of people have acne rosacea. It contributes to dry eye. And it can cause the staining, like the picture here. Those little dots where the arrow is pointing, that's not normal. There's not supposed to be on the cornea there. So when we get an overgrowth of bacteria, we normally have bacteria on our skin, but when it starts to overgrow, it can cause inflammation as well. The bacteria on our lashes release toxins into the tear film and irritate the eyes. Your eyelid margins become thick, and the bacteria can cause styes or chalazions like the top picture. And then there is what we call Demodex. Those are tiny mites that live on the eyelashes, seen by those little sleeves on the eyelashes. This is not a normal presentation. A lot of people come in with that and their eyes are red and irritated, and we have to get all of that cleaned up in order for them to start feeling better. Okay, so your eyelids have to have proper structure and function. So eye damage can occur when the lids don't close completely during a blink or while you're sleeping. So when the lids don't touch, the ocular surface is exposed and the oil is not produced. So no oil, tears evaporate. And when the lids do not touch, the ocular surface is exposed, no oils produced, and the tears are not drained. So the tears are just sitting on your eye, and those tears can have toxins build up in the tears. And then when you wake up in the morning, you feel miserable. Your eyes are just red and hurting because they've been open all night. So some things that you can do to prevent dry eye is you avoid blowing air directly into your eyes, like hair dryers, car heaters, air conditioners, and fans. Don't put that directly on you. You can add moisture to the air, like a humidifier. Consider wearing sunglasses when you're outside to avoid the wind and dust. And you can take breaks during long tasks. If you're at the computer, you should stop, do your blink exercises. After 20 minutes, look 20 feet away for 20 seconds so that can balance out your focusing and accommodation, and also get that oil to produce in your eyes. And when you're on the airplane, if you're in a desert climate, those can be extremely dry times. So just get a bottle preservative-free artificial tears and keep your eyes hydrated. Position your computer at below your eye level, because if you're looking up at your computer, your eyes are open wider. So then you have to, you won't blink as much. So no blinking, you're not producing the oil and your tears evaporate. And you stop smoking and don't go around a lot of smoke, because that can dry your eyes out as well.
So you have already delivered so much information about dry eyes, and one of the things I want to just tap into that you mentioned is that we're trying to educate the patient when they come to the office about dry eyes, because a lot of them don't know if they have it there. So they come into the office, they tell us about their problems that they're having. They're like, "Oh, doc, my eyes are tearing a lot." I remember you mentioned that. And a lot of times patients come in here and they're like, "No, I don't have dry eyes. I'm tearing a lot.
Yes.
I don't have that." That's one of the common things that we see and hear in the office there when patients come in. And then they'll talk about, how it feels like their eye is scratchy, to us there, and then, that slide that you had where you were showing the inflammation building up there is sometimes what we will see when we look at them, when we look at you guys under the slit lamp. The slit lamp here allows us to be able to magnify things so that we can see better what's going on the front surface of your eye there. I think why we start to see a lot in children now is because of something that you mentioned, Doc. They're not sleeping as much.
Yeah,
they're on electronics,
video
and they're
games
not
at night.
Right. You're thinking that they're asleep in their room. Parents, go an hour later and check on your children. They may not be asleep in the bed there. So I think, with their involvement on electronics, but also, with my daughter, she's doing a lot more now on the laptop. A lot of the work that they have to do is being submitted, through on the laptop. So our eyes are strained, more on our digital devices, our phones and our laptops there, which is affecting how our eyes are working and the quality of our tears there too. So I just wanted to, just tap in on those things that you mentioned. And then if you guys are listening, she also mentioned it's important for you to let us know about your medications. Bring a list, of medications in so that we can have that and see something may be causing you to have that irritation and dry eye symptoms that you are telling the doctor about there. So make sure that you bring those things in with you there, and we'll continue to help guide patients. As optometrists, we're going to try to guide you to, lifestyle, your lifestyle, your work routine that may be going on that's affecting you. I know Dr. Norwood talked about airplanes. When you travel, you may have to take you some artificial tears, with you on a
Mhm.
trip to keep your eyes lubricated because, of the environment that you're in. If you're working under a vent as well there too. So just wanted to just reiterate some of those things that you've already mentioned. And I hope that you guys are taking notes as she continued to tell us more about dry eyes there as well. Thank you, Doc. You're doing a great job.
Oh, thank you. Okay. So, so how's dry eye diagnosed? So you come in for your regular annual eye exam. We take your health history, we get your symptoms, your medications, ask you about your environment. We do a slit lamp exam on you, like Dr. Brown just showed you, evaluate your cornea. And we at Norwood Family Eye Care, we use what we call an Oculus Keratograph 5M. And I think I have some pictures on the next slide of what that does. It shows us each category that your eyes are deficient in. But, we also want to reiterate to patients that, you know, doing your routine eye exam, we do your glasses, your contact lenses, and then a lot of times we have you back for your dry eye evaluation because that's a lot more detailed and intense just to do in one visit. So this crystal tear report on the Oculus Keratograph, you see the pie chart at the top. It shows you every area where you are deficient in your dry eye, so we can give you recommendations and treatments in each area of your dry eyes. So some self-care home remedies that we can suggest to patients is to drink lots of water, get a diet high in omega-3s and fatty acids. We have warm compresses, cool compresses if you have an allergy component. We show you how to do blink exercises, and also, tell you, get out, exercise every day. 30 minutes of a cardiovascular 3 times a week can get you into a much healthier state than just sitting around. So I know it's hard for a lot of people to get a proper amount of sleep at night, but you know, get your 8 hours of sleep if you can, because when your eyes are closed, then that's when they're not dry. Um, Control your stress, control your anxiety, avoid your allergy triggers. There are also like sleep masks or sleep goggles that you can use at nighttime to keep your eyes moisturized. So some non-prescription things that we can do. We have medical grade omega-3 fatty acids in our office that we provide to patients, and not all omega-3s are the same. They have to have the alcohol taken out it so you can absorb it. So if you're buying generic medical omega-3s, off the shelf, they may not be absorbed into your body, so therefore they're not helping you at all. So preservative-free artificial tears are another one that we can suggest. So you don't want the preservatives in the artificial tears because preservatives can cause dry eye. So that's a lot of times people say, well, I'm using Clear Eyes or I'm using Visine. Those things have preservatives in it. So that's why your eyes are still red and dry. Um, there you can use eye wash saline solutions if you have bacteria components, tea tree oil, hypochlorous acid sprays, and also over-the-counter allergy drops if you have some itching in your eyes. Lid scrubs, OcuSoft lid scrubs, and I think I have some photos of some of these products on the next slide. Once again, I'm not a proponent of any company. They're not paying me to have this up here, but these are just some suggestions that we use, and that I suggest to my patients: the omega-3s, the lid scrubs, the artificial tears, and the over-the-counter Elasticaf and Pataday. So some prescription treatments, we can provide you with some short-term steroid drops. There are also autologous blood serums that can be made in the lab just for you. Sequa, Restasis, Zydra, type. I don't want to. Tyrvaya is a nasal spray that you can spray in your nose if you don't like eye drops, and that provides some relief for dry eyes. And we also prescribe antibiotic ointments or oral antibiotics. So those are the cyclosporins, the Sequa, and the Restasis, and Zydra uses another mechanism, the lifitegrast, and the Tyrvaya is the one that is the nasal spray. Some in-office treatments that we can do: we can put punctal plugs in. Those allow your tears to stay on your eye a longer amount of time. Lid debridement. Some more advanced or newer treatments is IPL, what's the intense pulse light therapy. Amniotic membranes can be used for severe inflammation. Tear care, lipoflow, where the meibomian glands are actually heated and then they're expressed to get them moving again. So if they're clogged up, they're not going to work properly. If you have bacteria like the Blefex or the Demodex on your eyelashes, we have Blefex to clean your eyelids, and new lids also, massages your eyelids. There is in-office allergy testing. So you want to know what you're allergic to. So when you do the allergy testing, there is a component that goes with that. The lab can make you some sublingual drops where you can desensitize yourself to that allergen, or you can know what to avoid. And also, if your eyelids need repairing, you can have a eyelid surgery if it's that extreme of a case. And these are some more devices. Some of them we have in our office, some of them we do not. But once again, I'm not a spokesperson for any of these products. We use Blefex in our office, the new lids, and we have tear care in the office. So another dry eye treatment is amniotic membranes. These are biological tissues from live, consenting, healthy mom and babies from an uncomplicated C-section. The tissues contain rich healing nutrients and protein that help stem cells, nerves regenerate to a healthier tissue. I have used this several times in my office. I've even used it on an 8-year-old. Well, she came in and her mom had gotten some lice shampoo in her eye, so she had very severe damage to her cornea. And we put on an amniotic membrane. She came back 2-3 days later. Cornea was good as new, seeing 20/20 out of that eye. So amniotic membranes can be a very helpful treatment. So I just want to say, everyone needs, eye exam. Whether you wear glasses or contact lenses, the health of your eye should be assessed. We're eye care professionals, so we assess the overall health of your eyes. If your eyes are burning, stinging, watery, uncomfortable, that's not normal. So you shouldn't walk around, feeling uncomfortable. So you come and see us and we can put a plan together to, help you feel a lot better. And just remember that your routine vision plan does not pay for dry eye treatment. Some of the office visits are covered under your medical plan. And some of the treatments for dry eye, most of them are not covered by insurance at all. So it's an out-of-pocket expense. So if you deal with dry eyes, just know that it's not an overnight fix. It sometimes takes 2 to 3 months for your eyes to feel better after you started a treatment. And when you have dry eye, you need to treat all of the components of dry eye. If you have meibomian gland dysfunction, we need to treat the meibomian glands. If you have blepharitis, we need to treat the blepharitis. We need to treat all of that at the same time so you can get relief, because treating one thing is just going to leave the other thing and you're going to still have symptoms. So just prepare, for a long haul of treatment when you're dealing with dry eye. And even when you get your symptoms under control and you're asymptomatic, you still have to do maintenance treatment in order for your eyes to stay clear and comfortable. So I hope that you found the information I provided um, helpful. And if you need me, you're more than welcome to come to my office and see your local eye care provider if you are having any of these symptoms, and don't walk around and feel miserable, because dry eye
Absolutely.
can lead to depression. We don't want to be depressed people.
No, we do not. We want happy people. We want to protect the vision. We want to help you keep your vision as long as possible and make sure that you're comfortable. And all of the things that Dr. Norwood has laid out are pathways to educating you and then trying to determine what's causing your dry eyes. As she said, once we find out what's causing it, let's treat all of those things. Let's get those underlying causes treated and make sure that we then outline a treatment plan for you as our patient, and then talk about the prognosis, talk about long-term prognosis as well. How are you going to do long-term? What is the pathway moving forward there? So don't keep these things a secret. I told someone that today, but it was related to context. Why are we finding out 6 months later? We want to
Yeah,
know as soon as possible before things get worse. We want to make sure that we step in as part of the providing team to help you when you're having discomfort.
yeah,
So make sure you communicate with your doctor, right, Dr. Norwood? They need to
yes.
communicate.
Because
Communication is the key.
a lot of times, if I mean, a patient will come back and it's like, well, my prescription is not right, and then we kind of figure out, well, you got some other issues, dry eye going on, and until we treat that, then the prescription is going to be off a little. So you got to treat those underlying things before you can have clear, comfortable vision.
Yes, and one of the things that you hit upon a little bit there is patience. Sometimes you guys who are listening may not understand your routine eye insurance doesn't allow us to go into deep detail about treating the dry eye
Mhm.
that you have in there. That's something, as she mentioned, your medical insurance then takes over to help pay for that. So if you hear your doctor kind of say that, we want to introduce it to you here first so that you're not caught by surprise. Routine, meaning
Mhm.
you get your refraction done for your glasses. To determine there, we look at you with the slit lamp. If we notice things, we bring it to your attention, and we have to talk with you about how your routine vision, is going to do this. But what we found, we need to maybe bring you back a different date, or we need to get your medical insurance and see if we can get you approved to be seen for the dry eye treatment that
Right.
is needed there as well. Two different pathways that your optometrists have to take sometimes when it comes to taking care of your eyes overall there. So don't be surprised when you go in. A lot of time we give the information sheet for patient history and everything is checked off. You know, and that's okay. We just want you guys to know, there are certain things that can be addressed under your routine eye insurance there. So we want to make sure that we also bring that to your attention as well there. You also talked about ways that they can improve on their dry eyes there by increasing water intake. A lot of people don't realize that. Drink
Yeah.
more water.
Yeah.
Some people think if they drink, soda,
No.
that's just as good. Is
Soda,
it?
tea, no. It's not a replacement for water.
It's not a replacement. So you heard it here tonight. You need to get your water intake in. Earlier, she gave you so many ounces that you need to do. I can't remember the number
Yeah.
there, but you need
Uh,
to make sure.
a general rule is you drink half your body weight in water. So if you weigh 200 pounds, you drink 100 ounces of water a day. I know that may be a lot of for a lot of people, but 8 glasses of water or the bottle, just
Hey, I
drink
got
it.
mine sitting right here, so I'm on board.
Yeah.
This goes with me every day. I'm
Yeah.
trying to. I'm almost at the bottom.
Hmm.
But and then I'll fill it up when I get home as well.
Hmm.
But we need to be aware of the intake of fluids, and making sure that we're getting enough water into our body there. And then you mentioned also omega 3s there as
Yeah.
well,
Hmm.
making sure that we're getting our omega 3s in, making sure that we're staying active, exercise, get outside, take a nice walk. I know right now it's hot outside,
Hmm.
so
Yeah.
we're recommending maybe the beginning of your day, early morning, or towards the end of the day, somewhere around 7:30, 8 o'clock, take a walk to exercise, so that you can keep that healthier lifestyle, trending for you. And then also, I remember you mentioned about warm compress.
Hmm.
Those help with the meibomian gland secretion as well. I remember in school where this lady, because you mentioned in your presentation about how the meibomian glands are so thick, and
Yeah.
we had to actually express the
Hmm.
stuff that was,
Yeah.
clogged in her meibomian glands. It was painful going through it at first, but she was relieved afterwards after we were able to express those meibomian glands there too. So if you guys are in discomfort, don't delay. Get your eye exam scheduled with your optometrist today. We're glad that Dr. Norwood was able to be our guest speaker and share all the different things about dry eyes on the show tonight and on the webinar. And if you guys have any questions, you can always post it in the comment section. We'll try to get back to you. I do have a shout out that I want to give on Facebook here. Nita. Nita said, thanks to this webinar tonight, Doc, she is going to schedule her appointment in New York and not put it off. So she
No.
want to give you thanks for being on as a guest speaker and sharing tonight to encourage her and inspire her to get her eyes done. I was just checking to make sure that we didn't have any more questions here at the bottom there. Good, good. All right. Doc, someone was asking, I don't know if you touched
Mhm.
upon about Visine, the do's, the don'ts, any other suggestions when it comes to Visine?
Visine has a preservative in it called BAK. That BAK can destroy the surface of the cornea, and a lot of people come in. They say, "Well, I've been using Visine for 3 months, and my eyes just keep getting redder and redder." Yes, they are redder and redder because the BAK is destroying your cornea. So that's why I said, if you want to use some kind of artificial tear or drop, just try to use the name brand drops, Sustain or Refresh, and the best ones are the preservative free ones, so that won't lead to any kind of cornea damage.
Absolutely. A lot of people, when they come in and we ask them, have you been using any artificial tears? That's one of the things that they'll sometimes mention that they've been using Visine for so long there and they haven't been, getting the relief that they were looking for. And as you mentioned, their sustain is one of the
Hmm.
drops that we'll often recommend to patients there as a starter there as well. And if something extreme is happening there, then we have to look at other treatment options there for the patient as well. So thank you for that. I'm just checking here to make sure. Shout out from Dr. Whitehead and Dr. Boone to you, Dr. Norwood.
Hi
And
guys.
and also Eleanor Clark said that this information that you delivered tonight was very informative. So she sent her love to you for delivering that information as well there. So we realize that our community is not always informed. You don't always know what's going on when it comes to your eyes and as well as your body as well. And that's why we do these webinars every third Monday in each month to try to educate the community to help protect the vision. And we have great guest speakers on the call, as Dr. Norwood did for us tonight. And we're very thankful for you, Doc. I'll let you
Thank
close
you.
out if you have any final words or words of inspiration that you would like to leave or for people that might want to follow you. I follow you on Instagram as well there too. So you can do so at this time.
Okay. Well, thank you, guys, for having me. The NOF. I hate I missed you guys at the convention this year. I was off trying to get married, trying to recover from a wedding.
Congratulations.
Thank you. Um, so I'll definitely be in Philadelphia next year for the NOA convention. And, like I said, if your eyes are bothering you, they don't feel right, it's not normal for them to feel uncomfortable. So see your local optometrist. And you can follow me on Facebook at Norwood FEC and also the same on Instagram at Norwood FEC.
All right. There we go, folks. Dr. Norwood signing off with us. Thank you for being on as our guest speaker again. It has been a pleasure having you, learning from you, and sharing this webinar with you today. And you guys can follow her on Facebook and also on Instagram there as well. So you guys make sure you take care of your eyes and make sure that you don't delay getting your eye exam scheduled today. Today is the day. So
Today.
thank you again, folks, for tuning in. This has been a great webinar here in the month of July for dry eye awareness. And we're so glad that we were able to have this great discussion with you. We ask that you would share. You can follow us on our YouTube channel and subscribe to our YouTube channel so that you're able to see this webinar again if you want to watch the replay or you want to send this webinar to some of your family and friends. We also are available. We have a website, nationaloptometricfoundation.com, that you can also go and learn more about what we do and see some photos that we have on our website. If you would like to donate, we have Cash App, $ Protecting the Vision, where you can donate small amounts, large amounts. We are a nonprofit organization, so it's tax write-off for you when you donate and allow us to be able to do the great things that we are doing as we support the National Optometric Association, students in high school, students in optometry school, and our community leaders out there as well. And thanks to our great sponsors like BSP, Hoya. Thank you all for showing up at the convention and supporting us. And we also want you guys to go to our Facebook page, National Optometric Foundation, and like our Facebook page there so that you can stay tuned to the great things that we continue to do as the National Optometric Foundation. It's been my pleasure serving as the treasurer for the National Optometric Foundation, working along with a great board, NOF board, along with our president, Dr. Whitehead. And I want to give a shout out to the outgoing National Optometric Association president, Dr. Larry Jones, and his great work that he's been doing for the NOA. And congratulations to our incoming president for the NOA, Dr. Barnes. And I'm telling you guys, we had a fantastic time in Fort Lauderdale at the National Optometric Association Convention. And you heard it from Dr. Norwood. You can meet us in Philadelphia. We'll be in Philadelphia for 2024 for the National Optometric Association Convention. And we look forward to seeing all of you there. So again, we appreciate you guys for tuning in on the webinar that we did tonight on dry eye. And we hope that you'll continue to tune in for our future webinars. We'll have another great speaker on next month in August, and we look forward to sharing with you there as well. So until then, have a great night, and thank you again for tuning in.